Hello, and welcome to Alcohol 101. Here's a roadmap of what to expect from today's presentation. We'll discuss the drinking patterns and behaviors of other VCU students, serving sizes for alcoholic beverages, the difference between buzzed, drunk, and blacked out, strategies to stay safer when drinking, what to do in an emergency, and we'll share resources if you'd like more support. VCU Recreation and Wellbeing, RecWell, was created to bring together two separate departments with the same vision of making VCU a healthier and happier place to learn, work, and grow. VCU RecWell has multiple facilities that provide different avenues for ways to engage with us. We're confident there is something for everyone, whether it is running on the track, lifting weights, playing tennis, or going for a swim. Additionally, we have locations on both Monroe Park and MCV campuses. I work on the health promotion end, so you can find our health promotion staff right here on campus at 815 South Cathedral Place. We also have facilities such as the Cary Street Field, the Tennis Center, and the Outing Renting Center. This is where you can rent outdoor equipment. At RecWell, we believe that health includes every part of you, and the health of all RAMs influences the health of each RAM. So, our health promotion team is here to give education without judgment on subjects that we know can be tough to navigate. This includes sexual health, alcohol and other drug use, nutrition, stress, self-care, sleep, and more. We actually do a lot out and about on campus to bring fun and engaging health programming to you. We offer resources and support, such as our Health Foundation learning modules on Canvas. These include trainings on topics such as managing stress with mindfulness, bystander intervention, and self-care and resources for well-being. We have a group of amazing peer health educators that bring education to fellow RAMs in a fun, positive, inclusive, and empowering way. And if you've been in a bathroom stall on campus, you've probably already met us. We're there each month with our Stall Seat Journal, providing facts, tips, and resources to stay well. Our goal is to advance student success by empowering the VCU community to prioritize well-being, connect with others, and learn through play. We believe that student voices are a key part of the work we do. That's why we work with a variety of student groups when promoting health on campus and beyond. We know that not everyone has had access to the same education about health. That's why we believe in creating a healthy environment that's positive, inclusive, and empowering. We pride ourselves on being a non-judgmental resource for students. So take a minute to think, what are some reasons people drink? Take your best guess. What percent of VCU students consumed alcohol within the past 30 days? %66% of VCU students consumed alcohol within the past 30 days. Have you heard? Most RAMs are in one of the following categories. They either do not drink at all, they drink no more than 5 days a month, or they stick to 0 to 3 drinks when partying. Does this surprise you? Why or why not? What do you think impacts our perception of drinking on college campuses? Let's get back to basics. Do you know what's in your cup? Let's chat about serving sizes for alcohol. What do I mean when I say serving size? Who here knows what one standard serving size is for beer, wine, or liquor? For beer, a standard serving size is 12 ounces, the size of a regular can or bottle. If you're drinking out of a red solo cup, you'll see lines on the cup that help you gauge serving sizes. 12 ounces of any drink should go up to the third line. One standard serving of wine is 5 ounces, or about 1/5 of a bottle. In a red solo cup, pour wine to the second line. One standard serving of liquor is 1.5 ounces. In a red solo cup, pour to the first line. You may notice that most shot glasses or Dixie cups are actually a little bigger than 1.5 ounces. To avoid overserving, don't pour shots all the way to the brim of the cup. What about malt liquor? This includes drinks like Four Locos and Limeritas. These drinks are sweet but surprisingly high in alcohol and tend to come in huge cans, so be careful. One can has almost 5 servings of alcohol. So what's the difference between buzzed, drunk, and blacked out? Have you heard that the more you drink, the better the buzz? That's not really true. When it comes to alcohol, more is definitely not better. So let's talk about the golden zone. Alcohol in the body has a biphasic response. What does this mean? Well, when you have your first few drinks of the night, alcohol might feel like it has a positive effect on your body. When you're buzzed, you might feel happy or euphoric. You're relaxed and your inhibitions are a little lower. Then we hit the point of no return, and your body starts to feel the negative effects of drinking. Alcohol is a depressant, so as you get drunk, your body starts to slow down. You may experience poor judgment, mood swings, memory loss, vomiting, passing out, and an increased risk of injury or death. With that, we want to stay in the golden zone by drinking in moderation and spacing drinks out throughout the night. This can prevent us from slipping from the buzzed phase to the drunk phase. Once you pass that golden zone, also known as the point of no return, you have lost the buzz, started to feel the drunk effects, and are most likely not going to go back to the happy buzzed phase. You're going to be feeling the depressant, drunk phase for the rest of the night until your body completely breaks down the alcohol in your system. Does this look familiar to anyone? You've probably heard of BAC, or blood alcohol content. This is the percentage of alcohol in your bloodstream. BAC is affected by a lot of factors, including your height and weight and the sex you were assigned at birth. BAC is also impacted by food, because food acts as a blocker that slows down the rate at which alcohol seeps into your bloodstream. Now, the BAC isn't perfect. There isn't enough research about how alcohol impacts trans and intersex folks. Your BAC can be measured with a breathalyzer, but it's pretty difficult to gauge your own BAC in the moment. Have you ever thought, wow, I really feel like a 0.06 right now? For this reason, it's good to understand your own personal limits when it comes to drinking. Let's take some time to reflect. Answer these questions to yourself. After how many drinks do I start feeling buzzed? Does food affect this? How do specific types of alcohol affect me? And what does it feel like when I've had too much to drink? We've established the difference between buzzed and drunk. What about passing out and blacking out? Passing out means that you have lost consciousness and you are not able to be awakened. This is not to be confused with a deep sleep that some people may fall into as a result of drinking. Blacking out is when you're still up, you're still moving, you're still dancing, you're still moving location to location, but you're not retaining any of those memories. Your hippocampus in your brain has turned off, and you are not going to remember anything about what you're doing. If your hippocampus has turned off, it is physically impossible for you to remember the events of that night, at least the ones that occurred during your blackout. So, how can we avoid dangerous side effects of drinking, like blacking out and passing out? Let's talk about some strategies to stay safer when drinking. Have you heard? Almost every single RAM takes at least one precaution to stay safer when drinking. So let's brainstorm. What are some ways that you and your friends stay safer when drinking? Here are some ways that RAMs stay safer when drinking. First, understand and recognize your personal limits. Keep track of your drinks throughout the night. Maybe bring a Sharpie with you and keep a tally on your wrist. Consider pouring your own drinks so you can watch the serving size. Watch out for drinks where you don't know what's in them, like punch or jungle juice. Eat before and during drinking, so food can act as a blocker for the alcohol. Eating after won't help sober you up. Alternate alcoholic drinks with non-alcoholic drinks like water or soda. Finish one drink before picking up another. Practice caution with drinking games because they're usually designed to get you drunk fast. So, what are some ways we can stay safer while playing drinking games? Stay with the same group of friends and watch out for each other. And lastly, before you start drinking, make sure you have a plan for how to get home safely. Now, what do we do if something seems to be really wrong? Do you know how to tell if someone is having an alcohol overdose? Remember pubs, puking while passed out, unresponsive to poking or pinching, breathing is shallow, slow, or they're not breathing, and skin is cold, clammy, or blue. These are all potential signs that somebody is overdosing on alcohol and needs medical attention immediately. If it seems like an emergency, it probably is. Call 911 off campus or VCU PD at 804-828-1234 if you're on campus. Students who seek medical attention for themselves or others for an emergency related to alcohol or other drug use will not be subject to disciplinary action by the university for prohibited behavior under the Student Code of Conduct. For more information about VCU's medical amnesty policy, refer to the Student Code of Conduct or visit policy.vcu.edu. Before we wrap up, here are a few on-campus resources that are here to support you. RamSafe provides safe and free transportation to on-campus locations and nearby residences and buildings within defined boundaries on the Monroe Park and MCV campuses. RamSafe will get you home safely, but it is not intended to be a personal taxi service and should not be used as such. RamSafe operates within VCU's jurisdiction 365 days a year. RAMS in Recovery is a VCU recovery program which works to ensure that students do not have to choose between their substance use recovery and their education. They offer recovery housing and scholarships and provide space and support for recovery meetings. University Counseling Services offers free in-person or virtual counseling for students, including individual, couples, and group therapy. University Counseling Services also houses confidential advocates who work with students who have experienced sexual violence, dating violence, and stalking. Not sure if you're ready to speak to a counselor? Check out the online self-help pages on topics like anxiety, depression, trauma, and relationships. Student Health Services is here to provide students with a variety of primary care services. To make an appointment, visit health.students.vcu.edu. And now we've reached the end of our presentation. Let's summarize what we talked about today. Most RAMs participate in safer drinking practices. We also talked about how to measure standard serving sizes for alcohol. We reflected on our personal limits for alcohol and the difference between buzzed, drunk, passed out, and blacked out. We brainstormed strategies to stay safer when drinking, and we learned about pubs for emergencies. Want to learn more about how to get involved with us and attend our programs? Check out our website, our social media, and join us on Rams Connect to stay in the loop on all of our fun events. Before we go, I'll leave you with this original song by Malcolm, a former student employee here at RecWell.
Hello, 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 hello. Hello, it's the well, you can tell cause it's me with the afro glasses and dope black tea and the 3 pieces of the PIE. We just wanna see VCU healthy. So let me set this table up. This whole story starts with the cup. What? Pretty much, if you wanna pour it up, there's a way to do it right so you're not messed up. We realize that the lines are a guide for the size and the type of the drinks that's inside. Cool, right? Yeah. That's why I'm here. I relay information straight to my peers when I do it in a way so it plays on the ears. So I sing it and it sticks and it stays through the years. I've been on the street trying to spark interest, start a conversation, but nobody's listening. Farting while I wait till somebody comes up with free alcohol, but they go away cause I don't have any buzz, man, that's just water. Well, that's awkward. Did you really think I'd be handing out vodka? Got a lot of bottles, but I wanna spread the knowledge, not exacerbate the problem. Wait, someone's coming and they're looking at me. We made eye contact and they're looking to speak. Are they looking for a cookie or a similar treat? Oh snap, it's a rap, guess I'm looking to teach. So what's up with this? I see you got the setup and the getup and the lick, and not a lot of people seem to talk about this, and I'm really interested, so respectfully spit. Nothing special or nothing, it's no pressure, I'm trusting in you to tell me the truth. What is this booth? Do you drink? Nah, that's cool. Mostly trying to focus on my job plus school. That I understand. What about your friends? They be sipping, but we chilling, you know? Cause killing someone's vibe is a no to me. I mean, of course, people wanna have fun, but what happens when the packaging is lacking the numbers and reactions are impacted so much faster than normal? Like, how many drinks do you think are in here? Off the top, on the spot, like how many shots? Yeah, well, it says 80 proof. 20, 25, 39, 42. Ooh. Nice. It's actually 39, but you got it on the dot on your second or third try. Have you seen our videos? No.
Whose man's is this?
Well, you should follow us so you'll be in the know. At the Well VCU, you can find us on your phone. Sure. I'll check it when I get home if you take some time to tell me about the zone. If you wanna drink the pleasure zone, indeed, that there is where you're gonna wanna be with the BAC around .03. You can have fun while doing it safely. .08 is not so great, then I can take a turn for the really worst. But wait, if you pace yourself and take yourself away from drinking games, then you will be okay. Drink water too and eat some food, my dude. You feel better when the morning comes, it's true. Take a few, they're full of information on the proper preparation for your latest celebration. Wow, man, I appreciate your patience. You've been really, really great, and this is super educational. Oh yeah, you're fine, you've been swell. If you have any questions, you can come to the Well.
You know where to find it.
Well.